Earlier, people used to think of appendix as a useless organ, vestigial organ, but of late research shows that appendix has got a definitive function. It is acting as a reservoir to the helpful colonic bacteria. Whenever colonic bacteria are being washed away, these bacteria, they grow back from the appendix. Now, people are very scared once they hear the name appendicitis. Now, what is it actually? It is nothing but inflammation of appendix. Patients usually have 3 symptoms. The 3 symptoms are very characteristic. Unless these 3 symptoms are there, we cannot call it as a acute appendicitis. One is fever, second is pain in the right lower abdomen, third is vomiting. So unless the 3 symptoms are there, we cannot call it as appendicitis, and if at all one of the symptoms is not there, then we can manage the problem conservatively. But there are cases wherein we should not manage conservatively, like in the case of kids below the age of 1.5 years, because their omentum is not fully developed. So if once the omentum is developed, it can help the localization of infection, but because omentum is not there in kids, it can lead to generalized peritonitis. So we should not wait in case of kids. And once there is appendicitis confirmed, then earlier we used to operate by open surgery. Nowadays laparoscopic surgery has made life very easy. Patient is discharged in 1 day. And there are few cases where all the 3 symptoms are not there. We call them as subacute appendicitis, and we try to treat them with medicine. What happens if appendicitis is not being treated immediately? See, appendix is inflamed, it becomes edematous, and omentum, the surrounding intestines, they try to contain the problem by adhering to the appendix. It will lead to the formation of a appendicular mass. But in any case, if the tip of the appendix bursts, it can lead to the formation of a localized peritonitis or appendicular abscess, wherein we have to drain the abscess, and at a later date, after 6 to 8 weeks, we will have to do a definitive procedure to remove the appendix. What in the case of a appendicular mass formation? We try to treat the patient with IV antibiotics for maybe 5 to 7 days, and once the pain is subsiding, we will wait for 6 to 8 weeks for all the adhesions inside the abdomen to separate, and then we will plan an interval appendicectomy. Once the appendix is inflamed, it is better, it is removed.